Good afternoon and welcome to Pittsburgh City Council's Cablecast Post Agenda on Wintertime and Homelessness for December 17th, 2025. I am Councilman Bob Sharland, and this is a post agenda that we've called in years past here and want to continue making an effort to kind of understand where we are in the city and in the region in terms of homelessness and our preparation for the winter here. I will allow our guests to introduce themselves and then listen to a presentation here, and we may be joined by other members as the presentation goes on.
Thank you so much. Camila Alarcón, Assistant Director in Public Safety, overseeing the Office of Community Health and Safety.
I am Ben Talek, the Program Manager for the Roots Program, also with the Office of Community Health and Safety.
Hi, Erin Dalton. I'm the Director of the county's Department of Human Services.
Hi, I'm Andy Halfhill, Administrator of Homeless Programs at the Department of Human Services.
All right. And if you guys want to go through your presentation, are we technologies set up?
Yep.
Okay, cool.
Great, thank you. Thanks for having us. I'll just offer a couple of higher level comments, and then I've asked Andy Halfhill, who just introduced himself, to present just where we are with the homeless system this winter. I think he will present a pretty stable picture in comparison to previous years when we were here, thankfully. Just to add to that, we've got a number of warming centers, including doing a lot of work with Second Avenue Commons this winter, some of which we'll start to see in early January, trying to improve the experience there during the day, and we'll be happy to have Jubilee Kitchen also back online, providing warm meals. Just to mention, we issued a solicitation just last week to engage outreach partners to be part of our continuum of care. So we issued that and wanted to make sure the folks from the city were aware of it. We're also issuing a broader call for volunteers for our point in time count. So that's something that happens every January in alignment with HUD requirements, and the new methodology we're using requires a lot more volunteers. So encouraging people to engage with us and volunteer to help us get a census of unsheltered homelessness this winter. Also just want to mention gratitude to our city partners for all kinds of things, but also for being a backup for us when winter shelters have challenges, including this morning where we had a pipe burst, and so worked with city partners to have a backup plan there, but also for longer term strategic initiatives like 500 and 500, the Urban Redevelopment Authority and the Housing Authority for the City of Pittsburgh. Amongst the partners in the mayor's office, were really critical partners in getting people housed through 500 and 500. And then lastly, we've been engaging through our continuum of care in a 5-year strategic plan for the homeless system, and so we'll be releasing that soon. So just some higher level updates, and we can update on any of those or provide more information, but Andy can talk through the actual winter plan for homelessness.
Great. Before you start, I just want to acknowledge we've been joined by Councilwoman Gross and Councilperson Strasburger, and take it away, Andy.
Great. All right. We just have a few slides to kind of lay out what our plans are for this winter and answer any questions. I think you'll see that our plan for this winter is very similar to what you heard last winter. I think last winter was very successful, and so we've really just building upon what we did last year. Our plan is to have sufficient capacity across our shelter system for anybody that would like to come inside throughout the winter. We were successful in that last year by adding additional shelter spaces and working closely with our outreach partners to get folks inside. So feel good about our plan, but we'll be continuing to monitor this. I'm actually monitoring this daily to see how our counts are looking so that we can adjust our plan if we need to. Just a little bit of background. So our shelter system, I'll talk a little bit about our shelter system for adults without children. We have a separate shelter system that is for families with children. But just thinking about our system for households without children. We have around 400 beds that are available year-round across a number of shelters across the county. Each winter, we add capacity to that. So for this winter specifically, we've added 232 additional winter seasonal beds. Those all opened up on November 15th. And just the details here. So we have 3 overflow programs. So 2nd Avenue Commons here downtown, East End Cooperative Ministry in East Liberty, and then the Salvation Army in East Liberty as well. So those 3 programs are each sort of like flex their capacity, add additional beds in the wintertime. So those all opened about a month ago and have been serving people well, sort of gradually filling up and serving people. And then we have the dedicated winter shelter that's at the Northside Partnership Project on the north side. That's 2610 Maple Avenue. That program has 141 beds. That's the same location we had last year. Was successful there, and so we're back there again this winter. And then one additional element is just last year we expanded capacity at 2nd Avenue Commons to have sort of 7-day-a-week services during the day, have weekend hours. That was an improvement, and it really helped people for those, sort of especially weekend hours and early morning hours. So that is happening once again. So I want to talk a little bit about the dedicated winter shelter. Again, I mentioned this is the 2nd year that we are working at this site. That program opened on the 15th of November, and we plan for that to stay open through the end of April this next year. Again, has a capacity of about 140 beds. That program is operated by our partner Community Family Advocates, and then we have staff at DHS here who are very involved, working closely with that program. The way that the program works is that the shelter has room for about 140 people each night. There's sort of designated spaces for males, designated space for females, and then an overflow space as well. So each night we have generally the majority of people coming to the shelter via a shuttle that comes from 2nd Avenue Commons each evening, makes several trips up there, and then drops folks off and circles back and picks up additional folks in the evening, and then returns people there in the morning. We do have a stop on the south side each evening at Unity Recovery to pick up people there who are looking to come to winter shelter and sort of get there directly from the south side. And then in the morning time, Light of Life is one of our partners, and so we've worked with them to have them be a spot where people can use their engagement center during the day. So drop off people directly there in the morning. People come, check in, there's security on site, and then once they go through security, then they receive dinner. There's breakfast provided in the morning. One key aspect of this is working with our street outreach partners. So we have a number of street medicine teams that are associated with PIT, Operation Safety Net, Central Outreach, Allegheny Health Network, and UPMC. So they are there a few days a week, just providing medical services, foot washing, different services to help people that might need it at the shelter. And then the last thing I'll just mention is that we are, I think, doing a better job this year of with some dedicated staffing to help connect people to other shelters, people that begin to be regular users of the winter shelter. They begin to get comfortable. It's a comfortable space for them, working to coordinate with them to think about moving on to other shelters, other housing programs that are good fits for them. So just want to talk a little bit about the numbers we've seen so far. So I mentioned that all of these services opened on the middle of November, November 15th. So we've had about 450 people, a little bit more than that have used these winter dedicated services since those programs opened. What we're seeing is that the majority of people who are coming to winter shelter really are just using it for a very short period. So just a few days. Most folks come for a day sporadically here or there, stay for a few days. There are, a small number of people who are using it regularly, but majority of people just have a very sort of acute need. We did see counts, of these last few days that were especially cold, counts go up, but we are sort of monitoring how many beds we have available in the system, and we've had plenty of space in the rest of the shelter system to serve people, so we haven't had any nights at all where folks have been turned away or haven't had capacity. That's really like our dedicated winter strategy. That is working well so far. Wanted to highlight, because we've talked about this in the past, just what our resources are for families with children. We absolutely never want households with children to experience unsheltered homelessness. And so the county has 7 shelter programs that operate throughout the county. At any given time, there's about capacity for 100 households to be served in those. But one of those programs is operated by Auberly, and they have the ability to sort of flex capacity at any time and sort of serve additional households as needed. So Allegheny Link is part of the Department of Human Services, and they coordinate all of those referrals to families to these different shelters throughout the day. So that's how that system works. We do have additionally 3 domestic violence shelters in addition to that serve families that may be experiencing domestic violence, and so that's an additional approximately 25 households that can be served in those programs at any time. Just wanted to highlight too that we have a website called Allegheny Connect that provides resources to anybody at any time that has all of this shelter information. And so obviously we can share these slides, but if you go to Allegheny Connect here, or you can call 211 and you'll receive a listing of all the different shelter resources that we have. We constantly update this to keep it current. I think that is it actually as far as our winter plans.
Does anyone else want to add anything? CHS folks?
Thank you. We wanted to add, we obviously don't run the winter shelters, but we are partners with the county, and we were able to talk to our teams. Right now, we have 4 teams of the Roots homeless outreach teams, and particularly the team in Zone 5 is flexing to 4 to make sure that we have coverage there. And the Zone 3 team is currently 2 members are also covering the whole of 6 and going the whole of 3 and going to 6 whenever it's needed. And the rest of the zones are 1, 2, and 5. But what they've been reporting is that folks are using the winter shelter at a higher rate than last year. People are more willing to go to these winter shelters, and particularly because of that added stop in Unity, our Zone 3 teams, the post-overdose team and the Roots team, have said that there's less folks sleeping rough, less folks sleeping in tents, and less folks in doorways because of that stop, because it has allowed them to be able to go to winter shelters. So that has been something that the trends they've seen these past couple of weeks, like 2 weeks. And I know that the Unity Drop-In Center does have an overnight capacity of being a drop-in center, but having that capability of being able to go to the winter shelter has helped a lot, particularly that area. So those were some of the conversations we had with the county about like access to it. So we are very happy to report that adding those stops into the shuttle. Other teams also in OCHS have mentioned that the stops from the shuttle on the way back, having places where people can access food, has also been a big motivator for folks to not be sleeping rough outside early in the morning. So social services are really important and a great motivator for folks to access them. And once they access this, at an initial point, this can lead to having more conversations to enter into the rest of the shelter and housing system. So I think that's been a great strategy. Obviously, we still have folks who don't want to be in congregate areas and who rejected any type of shelter. So I think it's really important to highlight outreach teams. Our outreach team has been amazing in finding folks, preparing them with winter gear, with survival items, but also taking street medicine, which are a great partner to us, to make sure that folks are not suffering from frostbite or any other life-threatening from the cold. So I really wanted to highlight that our outreach teams, especially, we got a lot of calls from your chiefs of staff this weekend because it was very, very cold, and I was happy to report that on Monday they had done checks throughout the day Friday, but on Monday everybody was accounted for, and thankfully had been able to withstand that weather. So I think sometimes outreach workers are not focused in this conversation, but they're an incredible resource for survival for our folks who are outside. And I wanted to really commend those teams that have been going in these conditions and checking on everybody. I know one of our team leads is working 2 days in a night in the shelter, in the winter shelter. And he is mainly helping with street medicine. And one of the amazing things that I wanted to highlight from the winter shelter is the fact that now people, when they come into the shelter, are screened for medical needs. That wasn't happening last year, and that has been crucial for folks to make sure they get the attention they need. So from our perspective, I think we are in a very good spot this winter, and the collaboration that we have with our county partners, but also previously. I think a lot of work happens before, particularly around mental health. We have been able to increase our case conferences with our county partners at a higher level. There's now a lot of different folks that are coming that provide a great expertise from the jail, from mental health providers, and that helps prepare folks as well for these events. So that's something that I wanted to highlight.
I'll just take 30 more seconds. So just a few things with what Camila was saying. Our downtown team lead is the person that she was referencing, Tim. We're fortunate enough that he continues to stay with the Roots program after becoming a nurse about, I think, 8 months ago now. So he's been volunteering. This is his second winter doing medical care over at the winter shelter with the rest of the street medicine teams. As Camila mentioned, like as the weather shifted, especially this last week with the extreme temperatures, like our teams worked, some of them through the weekend as well, just ensuring people are safe. This past Monday, we got a call from emergency management about a large increase in people experiencing homelessness at the senior center in the South Side. And so our South Side team lead and outreach worker spent a chunk of their day over there making sure these were people that were connected, seeing if they needed warm gear, if they were choosing to remain outside versus going to the winter shelter, and making sure they understood those resources there. So, I mean, we'll of course keep doing that. I think some of our daytime centers have gotten a little bit of a reprieve today with the warmer temperatures, but we'll pick it back up on Friday as the temperatures start dropping again.
Ben reminded me of something I want to highlight. The warming centers of the city were a great resource as well for us to have folks, but I know there's areas where they don't have warming centers that are very close. So I know that especially on Monday, our north side space was a great place for folks who didn't have access to a close warming center. So I think having conversations around drop-in centers can also be a resource for the community, not only for the unhoused, but for the community at large. We've been in the South Side, but in other of these warming centers or senior facilities, been coming in and helping folks with their needs. As we know, our older adult population has been experiencing homelessness at a higher rate than we've seen in the past couple of years. So checking in as well through our PINS program for folks whose living conditions, although they're housed, might not be the best during these conditions. If they don't have access to their utilities, we can work along that or access. So just wanted to highlight that.
Anything else from the team? Okay. With that, I think we'll transfer it over to questions from members. Councilwoman Gross, you were first here. If you're ready to go.
Thank you, Mr. Charlin. I appreciate having the post agenda and the discussion. I know it's a busy time of year for everybody on operations and on council side, but it's great to hear these updates. I mean, it really feels to me like more people are getting services and more people are getting shelter and more people are getting housed, right? And so let's just acknowledge that and say thank you, right? Because it's been a heavy lift and it's been a lot of focused policy and administrative attention to get here. So I really appreciate that. I also want to remind for anybody listening to make sure you didn't miss it, that for a very long time, that DHS's policy has been to house families with children. And I don't know that everybody realizes that and knows that. And so I want to acknowledge that as well and say thank you for that, because that doesn't happen everywhere. And it does happen here, and it's really important. So, we've talked about the nuts and bolts about different facilities, and thank you again for the success of the 500 and 500. We spent a lot of time and energy also trying to add that capacity into the system. And so we know that some people have moved all the way through that system into permanent housing. So I think that's a success story. Not that everybody can or is ready or whatever, and people have different paths, but there is a path now that it has more capacity in it that had a bottleneck before. And so I think that's really important. What I did also hear, and maybe you can help me understand if I was hearing this correctly, because it was in a little bit of pieces from what each person said, is that we definitely have higher participation in the overflow and in the winter shelters, but that it's attributed mainly to some of the things that were helpful was this shuttle, this literally the physical transit, like more transportation. Because what I heard also is that the transportation was maybe helping people get not just to this maybe bed at a congregate shelter that they had, but maybe to the other resources they needed as well, or to food resources, right? And so in previous years that, people don't have cars that are trying to, so if they couldn't, they would feel like cut off and unable to like have some autonomy or even to meet their own needs, right? And so that's been an addition. So I think that's really impressive. So, increasing people's access to transit and their food is really kind of like what everybody needs, right? Like we talk about this a lot, not just for people who are unhoused. And that, did I hear correctly that you also added kind of medical screening and medical assistance in intake and mental health screening and assistance, or that was happening before? I kind of not sure how that is working.
Yeah, there's been medical supports the last couple of years, but I think it's just expanded a little bit more this year. I wouldn't necessarily say that there are dedicated mental health supports, but we have a lot of different teams that are coming into this space, whether it be different outreach teams, the Allegheny Link team, different street medicine teams that are coming there to meet with people, right? So, yeah.
Just to add, during the day, certainly at Second Avenue Commons, there's a full medical clinic with behavioral health care. And so the winter shelter is mostly an overnight situation. So it's great to have the medical care there, but primarily the behavioral health care would happen, during the daytime. And though any of our teams can respond to the shelter too, if there are concerns, if somebody's in acute crisis, we would not let that.
Thank you. That's exactly where my mind was going. Yeah. It's not just that individual person might say, both that an individual person might be like, yes, I will go I will take that bed because, I can get there, or I can also get to the other things that it's working for me logistically, and there's things that I can get. But then also just imagining being on the floor of a congregate shelter, having fewer people there in some kind of dire crisis has got to be better for everybody, right? I don't know if that's the reality, but that's what I'm imagining.
Yeah, that's what I was referring, I think there's like a holistic plan to make sure that these things work better. And I think this past year, we've really focused with the county on doing more mental health focus, acute, complex need case conferences during the day to make sure that we can help those folks in need. So it's not only just providing shelter, but it's providing all of these supports. Our crisis teams, particularly working in these areas and being able to, now that there's 2 clinicians, to work in tandem with the county team. So our Zone 1 team lead for Roots specifically told us they work really closely with Resolve there to help transport folks into that winter shelter. So because they have longer operational hours, right? And we right now currently can only do daylight. So we have that partner, and because of those case conferences that we've been able to have now, they know who are the folks, they know what we're doing, and they've been able to help us transport some of those folks into the winter shelter.
Thank you, Director. That's really seems like a big operational change. So I really appreciate that. Again, even if it's not yourself, right? Imagine like you're 2 feet away from a person who's either got a dire medical crisis or mental health crisis. It's not as, it's difficult. That would be difficult. So thank you. And then I did also write down to expand, if we can, find better citywide coverage for drop-in warming centers. Because again, I've definitely experienced this, right? We don't really have a warming center. And so we're told to, like, East Liberty is closed, or like literally, and there have been winter episodes where public safety told me I had to tell my constituents to go to Penn Hills, right? And so we don't want that, right? We want it to be, not everybody can get to this suburban location where you have to drive to, right? We want to make sure that we have locations that people can get to, because sometimes they are cold in their homes. And we have to watch out for that. And we definitely have seen an increase in my time on council in the last 12 months of seniors in need of assistance, people in need of assistance that we're having to call OCHS. I mean, people who you have saved lives. I mean, our OCHS Rona has saved the lives of people who are in their homes, but in very dire situations. And so, those could end up contributing to the homeless crisis as well. So, heard, and I wrote that down. So we'll work on those things. I appreciate it. I think that's all I have. I don't have any other questions. Thank you, Mr. Chair.
Okay. Councilperson Strasburg.
Thank you, Mr. Chair. Well, just thank you for calling this, because we don't have an official task force on City Council anymore, or it's not as much of a focus in the news in terms of what City Council is doing to focus on this issue. It's still top of mind in every single district, and this is a helpful refresher as to how everyone works together on this critical issue. And the only question that I can think of now that goes above and beyond, or like is different from what we've heard so far, is I know that there is so little that we can do to force someone to go indoors when they are they're living outside and they are sleeping outside, and they, for any number of reasons, prefer to stay outside. And I know many of you have been looped into the conversation that mostly Councilwoman Warwick has been sort of trying to navigate, but I've been on those emails as well. Like, people express concern, and it's so hard for us to tell them, like, our wellness, there are wellness workers who are working with them, doing everything possible. Police might show up, and like, I want to just ask the question to make sure that I'm asking it here. There's nothing more than we can do than we're already doing, and it's not as if we're like not learning from other municipalities or states or any other jurisdictions. We're not doing anything differently here than you would see in New York City or Houston. Well, Houston doesn't have the same cold weather, but New York City is often brought up as a model by folks who express concern, and just wanted to ask a question and make sure that there's like nothing we're leaving on the table here in terms of helping folks get inside when it's really, really cold. And I'm actually like truly surprised to learn that there are some people who made it through these last few days living outside and are okay. Like, it doesn't seem possible, but somehow they are. So I guess I'm glad, but I know it's a really tricky situation. There's not much we can do. Wanted to ask that, get the answer, and continue to be able to convey that to the folks who are concerned.
Yeah, that's a really great question. I know, I think you were on those emails from this weekend about one particular person in Squirrel Hill. Seeing this is really difficult for outreach as well. I know for me, like, I've been doing this work since 2010, and every winter it feels harder than ever to know you're leaving people outside. And with that person, I think this is their third winter staying outside. When I talk about, like, we've tried everything, obviously there's the initial engagement. If we are struggling and we're concerned about their safety, Resolve is typically our first call. For OCHS specifically, we have the benefits of our clinicians as well that work here. But we check in with Resolve. We often talk to the Resolve director, Dr. Jack Rizal, to talk about the symptoms that we're seeing of people, ensuring that they do in fact have the capacity to understand the risks that are involved with living outside in extreme temperatures, and of course making sure people have that capacity to make those decisions. Beyond that, I know some other cities, I believe Florida in particular, has attempted to involuntarily commit people for the opposite extreme temperature, and it's not something that mental hospitals typically hold for. And like we've had this discussion also with WIPIC as well and those clinicians, and it's there's just again so little we can do. I think this year in particular, as Aaron and Andy were mentioning earlier, we do have the shelter capacity throughout the winter, which has been hugely beneficial. I think this is the first year, like I think for the first several hours my teams were outside on Monday. They were having difficulty finding people because they were either in the senior center downtown, or I'm sorry, in the south side. They were in downtown at 2AC. They were at our site in the north side. So we do have at least that going for us.
And just adding what Ben is saying, we have also studied, Ben has been crucial in that, and what other cities with cold weather do for folks to be able to survive. So thanks to a lot of our grants, we're able to buy a lot of things like hand warmers, special blankets, different things to help them survive. I would say, because we get those questions as well, I think that for the communities, they should feel that the majority of the people are accessing these services and are safe, and that is an outlier, and that person will 100% be checked on, will 100% be cared for. I think Ben and I worked through the weekend to make sure that we were getting those calls and make sure that there was someone who is also checking in. Never be afraid to call 911 if EMS is needed. If it's a medical emergency, that is an amazing resource that we have, that some folks feel like if they call 911, it's going to be like a punitive response, and it's not. It's a public health response as well. So that is something that I think can, as well, like, calm a little bit about the people, but we get those emails. I understand. That's a great question.
Just nothing significant to add, except to say I think it's known that we're offering whatever folks will take. It's not that we would expect all of those folks to go into a congregate situation. We are offering anything that people will take at that point. So while we focus on the winter shelter kind of resources, we have lots of scattered site shelter and other housing opportunities for people who really don't feel safe in those environments. And so Ben's team, everybody knows that anything is really available for people in those situations. And I agree with Ben that while 302 often is not going to, an involuntary commitment is often not going to stick in those situations, in certain instances, it is clinically appropriate. People aren't at that point able to make decisions for themselves and are, at significant safety risk. And so those things do happen, but they are not long-term solutions. That's not going to hold people all winter. That's not, if people want to be outside, it's not, our laws don't allow us to hold them, for long periods of time. But we do use those tools when we have to, or when we think it's clinically, when clinicians feel it's appropriate. And there are other laws across the country, and including in New York, that are allow for more flexibility in risk to self and others that just don't exist in Pennsylvania.
So bottom line, we are caring for these folks, even if we don't witness it hour to hour. Even if that person who's calling us or emailing us doesn't see it happening, we collectively are caring for those folks. Yeah, okay.
One last thing to add. I think some of our most vulnerable neighbors, I'm thinking of one in Hazelwood that Camila had also got a call this weekend. She is somebody that I've personally stopped by late at night to make sure her gloves are dry, make sure she has hand warmers. She's also been very unwilling to go inside. The person in Squirrel Hill has not been really engageable and has refused all items that are given or opportunities for shelter. But these are people, like if we know someone's staying outside and we know there's extreme weather, whether it's freezing, it's hot, there's flooding risks, like our teams will go out after hours. Every single person on my team has been really phenomenal at that if they think that somebody is at extreme risk.
Just last thing, because I think we haven't acknowledged, we saw in that Hazelwood reminded me, our religious leaders. Sometimes an outreach worker might not be the person that they will listen to, but in this situation, it was a religious leader that was able to get this person to a shelter. So I think our religious leaders are doing an amazing job as well. They have really strong ties to the community, and they are kind of like we don't highlight them as much of like all the work these different churches in your different districts are doing to keep people safe. And we have collaborated with a lot of them, but wanted to make sure because they've been very, very important in situations where it's extreme.
Thank you all. That's all I have, Mr. Chair. Thank you.
Thank you. Councilwoman Kale-Smith?
Thank you. Thank you, Councilman, for hosting the meeting and making sure you're following up. Thank you all for being here. I just really wanted to come out and thank you, Camilla, for the work that you've done. And you are working all weekend. I can attest to that because I've contacted you. So I want to thank you for the work that you've been doing. And but I do have some concerns because I hear what you're saying about if people can make a decision about whether or not they want to, seek help or get shelter. But sometimes if somebody has an addiction problem, they can't make those decisions. And so I worry because, we have that gentleman in my area. And I mean, he not only can he not make the decision, but his friends are now also, have addiction problems, and they're also coming together. And sooner or later, this has an effect on the city, on the community, on people, the businesses around. Whether or not they want to get help or not sometimes shouldn't be just left up to them, because I think, and I don't think just 302 somebody, I think, maybe making sure we're getting shelter and help. And I'm just wondering what you do in terms of mental health or any kind of addiction issues. What is the response if somebody doesn't want it?
And Ben has been working very closely with that gentleman, so he can speak more of the steps we're doing. But we do have peers now that have gone through that, who have lived experience with substance use, and we have been successful with having someone talk through. It takes a little bit more time, but I acknowledge that situation. We might lose that space, right? Because there's other people who are waiting for it. And that's one of the other things, that it's not only winter shelter. The county helped us get this single room occupancy space. But when we've tried to do, like our clinicians get involved and do those assessments, the problem is those will not hold in like a magistrate, or they will not hold, or we don't have the laws to permit us to do certain things. What we'll do in that situation is get...
Is that a state law or city law? What law is it?
State.
State law.
State
I just want to know
law.
who I'm going to lobby.
Yes, yes, state law.
Okay.
And what we do is we try to like flood that person with as many people as we can. I know we talked about maybe in that situation.
Can I just say something real quick?
Yeah.
So a lot of times people think it's the city not doing things.
Exactly, yeah.
But they don't realize we sometimes have to follow, state and federal laws.
Correct.
And so I just want to make sure people understand that we maybe just be following the laws. So
Yes,
I'm sorry.
that's
I just wanted to point that out.
that's super important, because that really limits and creates barriers
Right.
for us. And that situation, we're trying to work around maybe the pet and so we try to different angles to try and get somewhere, but it is a concern and it is a struggle, and Ben has been working with this person every day of like.
I feel so bad for him because he actually is not well physically either. So I
Yeah.
just feel so bad.
Just to add, I mean, there are very few opportunities for involuntary commitments of any kind. Like I'm not going to remember the right number, but for children, there's a procedure if they're addicted to substance use, have a substance use disorder, addicted to substances, that their parents or others can petition for. But those are also really hard to uphold. I will say that the county's been exploring for a number of years opting into a law in Pennsylvania that allows us to work under a lesser threshold, and it's called assisted outpatient treatment. It's for mental health or substance use, where we can, family members or others, practitioners, healthcare providers, can petition this, on the civil side, to have people engage in an assessment and then get outpatient treatment. So we are, as of January 1, we will opt into that opportunity in Allegheny County. So the threshold is lower, and it doesn't require inpatient care, because oftentimes inpatient care people aren't ready for, and it disconnects them from their community. They may, be working, they may have other opportunities, their family members that they aren't ready to be disconnected from. So it provides both an opportunity to support people to stay in outpatient care, and it lowers the threshold, that 302s. It's controversial. Anytime you're weighing what we all are sharing here, the concern for people dying on the street with people's civil liberties. I mean, treatment and care is viewed as voluntary. And so it's always a really challenging decision, but we think after lots of years of study and engagement that it has the opportunity to improve outcomes for people with low risk of a harm, and we're going to monitor it carefully as we opt in on January 1.
So I'm glad that you're doing it. And what I say to people all the time is, if I ever get in a situation where I am in that, don't think you're doing me a favor by letting me die on the street. Don't let me suffer on the street. Don't think you're doing me you're not helping anybody. And so when I hear some of these advocacy groups, and things that they advocate for, it makes me frustrated, because I'm thinking, who are you really helping? Because look at this. This is not help, and this is not humane, and to me, it's not in America. I think that looks great. I think it's terrible that we have people all over the place, and struggling, suffering, dying, just everything. It just makes me sick. That I feel like in this day and age, there should be a place and way that we can house people and help people, and do it without having to worry about the public scrutiny, and we're doing what's best. But what that also brings me to is several times I've called you, and you've always helped. I want to say that. But part of the problem is a lot of the people that you're trying to help don't want to go into the shelters because they don't feel safe, or something happened to them in the shelter. So who oversees them? All the shelters, like whether it's private, whether it's publicly, who oversees the management of it to make sure that people are? Because to me, if I was an advocacy group, that's what I would be advocating for, to make sure that the place where people are staying, that we're housing people, is safe, and that they're safe and they feel welcome and secure in those homes. Otherwise, you're not doing anybody help. You're helping yourself and your own organization. You're not really helping people. So could you tell me who oversees that and what?
Yeah, and Andy, feel free to add in. I mean, the county oversees the shelters. We monitor them. We have processes where if people, for example, are kicked out because we get, concerns about that there are rules around how that can happen, that people understand their rights within the shelter system, that people can appeal that. And we monitor incidents as they happen. So, providers are required to report critical incidents if there's violence at the site, whether it's between individuals or staff and people we're serving. We have a very robust director's action line, which takes complaints from people, and we get plenty of them about the shelter system, which we investigate and seek to improve. I think a strength of our shelter system is that there are private providers, and they run them slightly differently, and so some people may feel more safe in one setting than another, and so there's choice in that. And truly, people feel differently in different settings. And as we mentioned earlier, we also have a pretty robust system of shelter beds with doors, right? So for people for whom a congregate setting, regardless of how well we monitor it, how well it's run, just is overwhelming and too traumatic for them, that we allow people like Ben and others who work with the population every day to prioritize those beds for those folks. And in fact, we're just about to issue a solicitation that will increase the capacity of those what we call scattered site shelter beds, as well as other housing opportunities for folks.
We had a woman that was on the portico for a while, and she stayed on the portico because she didn't want to go to a shelter because she was raped in a shelter, if I'm not mistaken. And then her boyfriend stayed with her, too. So there was then two people then that were homeless and didn't feel safe. And to me, that is so important, that they're safe, that people feel safe.
And anyone here can correct me if I'm wrong. It takes a lot of engagement. I don't know those folks to name them, but for most people, there is a solution. We just have to find it. I suspect I don't know this, but like we will find solutions for folks like that, except for the very rare. We all can name them by name, people who truly will not come inside for any option. And so the key is really trying to find, and that's why we rely so heavily on outreach teams who know those folks and try and engage every day to find that thing that will help them to feel safe, and then we can offer it. We have those resources in our system.
To me, that's what I care about, because I mean, it hurts my heart that somebody's afraid to even go to a shelter to get home. You know what I mean? It has to be hard to even go to a shelter, but then to be afraid to go to a shelter is it's upsetting. And lastly, I don't know, you probably don't have the resources or the funding to do something, but is there anything that you look for, like for preventive-wise? Like if we have somebody that, is coming to us for the Housing Opportunity Fund, and we know that they're struggling, like is there any kind of resources that we bring in other than just immediate assistance? Is there some way that we get some counseling, some help, some, job skills, whatever it is that might be, addiction help, whatever it might be needed? Or is that too much? Is that too much to ask? Prevention? Okay.
No, yeah, absolutely not
I'm going
too
to
much
stop people
ask.
from getting to the streets. What I'm going to do.
Yeah, I truthfully, first I'll say I wish we had more resources for that. We partner pretty closely with the Center for Employment Opportunities, who's been really great at helping some of our people get into their paid job training program right on Ross Street, where they also help get into longer-term employment services. We work very closely. One of my good friends is the director at the Housing Stabilization Center on 7th Street downtown. They've been really great at helping with some of that, like pre-homeless service funding. Somebody is maybe lost a job and is behind on rent, or again is looking for another job,
Right.
or behind on utility payments. They've been really helpful at getting people connected to the resources to keep them in their homes so they don't enter that homeless system. We never turn anybody away either coming into our sites, any of the root sites specifically. We do focus on people living outside or in shelter. But if we have a family coming in who is just looking for any resource to remain in their home, we'll do whatever it is to connect them. Sorry, one more thing. You also mentioned like mental health and substance abuse. We continue to partner really closely with UPMC and Allegheny Health Network to get people connected to those services. The gentleman you were referring to earlier that you called Camila about, he's actually expressed immediate interest in getting help for his addiction. However, what we see with a lot of people is I really want this. However, I can't do this until I'm inside. And I think for so many people, unless you're really taking care of their absolute basic needs, which when somebody's living outside is survival, any of these like higher level goals, whether it's addiction treatment or mental health treatment or whatever it else is completely unachievable. So we've gone back and forth with him a lot over the last several weeks. We have a bed reserved for him. Aaron was mentioning working with the shelter system to make sure we prioritize our most vulnerable people. And because of some of his ailments, we were able to get him in within just a couple days of meeting him. But we're still struggling to get him through that front door. Yeah.
Convince him that's a good thing. But I do want to thank you, because he's like a rock star. I mean, everybody loves this guy. They go talk to him. At Thanksgiving, he had more meals stacked up than anybody I know. I mean, it was crazy. I mean, everybody in the community was feeding him. He could run for office one day, but he just, needs to take that step to get help.
Yeah, I will say the preventative is something that in the past 2 years we've been focusing on OCHS, so our other teams do a lot of that work through, and it's always great to get your referrals. So folks who are not unhoused but might be experiencing instability. So working together with EMS and the fire department with our people in need of support unit, we've been able to get folks chair lifts or back access to their utilities. We've been able to get them
I have somebody
jobs.
needs a chairlift. I'm glad you said that. I'm
And
gonna call you
these
about
are
that.
things that prevent folks
Give you one
from
more thing to add to your
becoming
list.
homeless. So, and it's also a lot of our programs, our new program for community resilience is about going to the community and asking the community, what are specifically do you need to not get to the point where it's reactive? I think a lot of our other programs are very much preventative in making sure that we can target individuals before they experience that crisis. So, and I think that's what the Roots program does too. And we've been trying to help people understand that a lot of our drop-in centers are not homeless shelters, but our community engagement centers where everyone from the community, our Zone 5 was hosting food every Friday. Really good. The People of India food. I think we fed over thousands of people in the Zone 5 area. So there's a lot of things that are preventative, but I think a lot of the things that get showcased obviously are the reactionary because it's such a dire need. But I think that's something super important. Thank you for highlighting. Preventative work is what we really want to focus on.
And just to add, I mean, I think I second what these guys have said already. And so many of the resources at the Department of Human Services really are aimed at that prevention. I mean, on any given day, there's over 50,000 people in the mental health system here, just the publicly funded mental health system. People are getting access to help and care. In our child protection system, we pay for millions of dollars of concrete aid to keep families stable in their homes. Our senior services do the same. I'll let Camilla get the
I'd
chairlift,
love to
but
talk
we
to you
can
more
do
about the keeping kids in their home and keeping the kids safe, and I think sometimes they're two separate things. But
Just-
on
oh, yeah, go
a
ahead.
separate, and
Yeah.
also about the hoarding. We talked about a hoarding task force. I think about 2 years ago. So when we're done, I'd like to talk offline about that. Some of those.
Sure. I will say that the something that is specifically targeted to, and we're trying to make it more so to reduce homelessness is the eviction prevention programs that both the city and the county have supported over the past few years. And we've done work in the most recent period, since there's not the huge federal funding anymore, to make sure that we are targeting those resources to people that have some risk of homelessness. And so we're paying rent payments there too. And again, the city's contributing to those efforts to reduce evictions and reduce homelessness through really proactive tiered rental assistance for those most at risk. Yeah.
We did apply to a federal grant for a hoarding task force, but focused on a clinical. So having our clinicians be part of the hoarding task force, and the county supported our application with a letter of support. So we hopefully will hear from that, which will allow us to go into those homes with a more of a clinical focus on how to help folks, because a lot of the times we obviously help them. My team has gone into, I remember one in Councilman Charlin's district where we clean. This is a person who had lived for 20 years in their apartment and it was getting demolished or sold. And the team went on weekdays and weekends and cleaned and, dressed her, fed her. And so I think those are the things that we do now, but we want to have a clinical focus where we can come in and provide folks who have, the hoarding, those hoarding challenges. So we are looking forward to hearing back from that federal funding to have a hoarding task force in OCHS that we can deploy, because we've seen from your referrals, we've seen from the needs. It's really an invisible thing, but we do see it, and our PINS program has been incredible with our liaisons, James Latowski and Chad Horosky. They from EMS and Fire have been incredible, along with our team lead, Sarah Hershey. So they came up with that together, and we've applied to it. So seen and definitely.
Thank you.
Yep.
I think I've told you this before, that I know 2 separate families where the kids were taken out of the homes because of hoarding, and then the kids were abused in every foster home, every home they went in. So it's just this, and then you talk about adding to the mental health, concerns and issues. So to me, it's just, where can you start it and where can you prevent it? And That's the part of that. I mean, it hurts my heart when I see kids with some of the things they've gone through. So, okay, I'm gonna shut up because I'm gonna start crying. All right. All right. Thank you all for your work. I know it's a lot of work. I know it's overwhelming, and I'm glad that you're continuing the mental health programs and meetings. So thank you.
Thank you. And no one's online, I believe. So go to me here. My question. I would just want to start off by thanking you again for coming in. With something we've done kind of periodically here. We unfortunately did this one a little bit later in the year than we intended. Some scheduling issues on our end, and appreciate you being willing to come in and talk to us about the plan as the plan's in place. So I did want to start with just the simple question here that an update I had not received. Is Second Avenue Commons, is it fully functional at this point? Is everything back to pre-fire capacity and programming?
Second Avenue Commons is fully available for use. There's one floor that Second Avenue Commons has its own board and is its own entity that they are still looking for best fit to use that floor. It's a difficult building, as you know, to manage with different populations, and so there is still a floor with opportunity for housing, and I know Second Avenue Commons board is working to identify the right fit program to go in there.
Was that the SRO floor?
There were two SRO floors, and now one floor. We've got Western Psych is running a program on the 5th floor, and looking for, again, the board is looking for the right opportunity on the 4th floor.
Okay, thank you. Yeah.
No, I don't take it lightly that there's opportunity for more people to be housed that we are not currently using. I'm the first to complain when we can't find a place to, to house people, and so we can't leave things without proper use. So it's certainly on our radar.
Sure. Yeah, I'm sure that some of you are thinking about. More just that I really hadn't received an update on, if everything was up and running here. Okay, so I was really interested last year in the new way that we're counting point in time, how we're going to go about that. Now that you have run you ran both point in times last year, what have you learned, and what do we think the trend will be this year as we go through that? What is the date for that?
January 27th. We'll confirm that. It's
okay.
It's the last Tuesday of the month. 27th. Yeah. No. Thank you for the question. So yes, we ran two separate points in time count last year. I would say this year will be fundamentally different than either of those two. So we worked with some partners who have helped, so Bloomberg Associates, who have helped cities around the country and the world run point-in-time counts. So they worked with us and the city and a number of outreach and advocate partners to design something we think will work here. One of the things that's different, and I'll let Andy jump in, he's been working on it on a regular basis, is that it will occur at night, right? So, in New York City and Paris, France, and all around the world, the counts happen at night, right? They happen between 10 p.m. and 4 a.m., and you approach anyone who's outside and you ask them if they have some place to stay that night. That's not what we were doing, and we will be doing the count at night this year, save for a few locations that we think are just too unsafe for the people staying there and the teams doing the count to do during that period. I would say in previous years, we roughly, we made an assessment of places where we thought there were people experiencing unhoused homelessness, and we went there and we did a proper count. We have done that, and we will sample in all of those blocks, but we are also doing a random sample across the rest of the county so that we are covering more of the county than we have ever before, and then we will extrapolate those results across the whole county, so using basic statistical methods. So we will get a more robust count of the population. We are I mentioned at the top, we need a lot more volunteers to do it this way. And so we're seeking about 300 volunteers. We're partnering with a number of healthcare, UPMC, Highmark, the universities, United Way, and others. And we'd love to have partners from the city. The city will participate in various aspects of it regardless, but if city employees are encouraged to volunteer, that would be great. We've got cool hats this year. That's like new marketing. Andy, what have I missed in terms of the changes?
I think you really covered. I think we're calling it community counts. So if you see that branding, that's the branding. Community counts. You missed 300 volunteers. So that more of a focus on more randomly sampling the outlying areas. So kind of in that vein, having like hubs that we set up around the area where we'll have volunteers be assigned and sort of staff who are training those volunteers and send them out, kind of managing. So just more coordination in that aspect this year. And I will say too that like throughout this process, you talked about point time count in the spring. We've been meeting with representatives from Bloomberg Associates who provide a lot of consulting around point time count internationally, and so we've been meeting with them regularly to get their feedback and collaboration. So that's been huge.
And to your question about what do we expect the trend to be, we've never done a count like this before. This is a break from the way we've done it in the past. But we will be able to replicate this methodology going forward. So we do stand a chance of looking at a trend year over year. But I actually have no idea what this count will reveal in terms of numbers, because we've never done it like this before.
Yeah, my understanding has always been that the point in time, is controversial for other reasons, but the usefulness of it is the trend and not necessarily the count. So I'm excited to hear that you're looking at like this is the way we're going to do it, and this is the way we'll do it for forever. So we can it doesn't matter if the number stays at 406. What matters is that it moves, in what direction it's moving. We'll look forward to that, and I don't know, maybe something we can figure out how to help with more city employees helping out with that overnight. So we did talk a lot about what happens when folks are rejecting help, and that was kind of one of my questions there. But one of the trends that I've noticed specifically in my district is not the what we call the encampments, or it's a lot more. There are spots, there are locations, but it's a lot more people in abandoned houses and people kind of in one-offs. Can you talk to me a little about what you're seeing in trends that looks different this year, and how you're kind of responding to it? Might be better for both of you.
Yeah, we'll definitely allow both. This is a place where I feel like we have obviously great partnership with the city. A data partnership I would like to make sure happens that I don't think I currently have in place is the 311 calls that you all get on people in who might be staying in abandoned homes. I don't feel like I have a good measure on it. I hear what you're hearing, that from street outreach, and I believe what they're saying, that there are more people staying in abandons, but I do think we can do better on tracking that over time, and then that will help us to make sure we're actually addressing it. And that's not to say it's not being addressed now. I think our outreach teams have a good sense of what's going on there, but I do want, just like tents, I think it's helpful to track that and be able to show increases or reductions, and show when our efforts are working or when they're not working. And I think any effort to support people in those situations will both require making the right offers of help and assistance and engagement, but also, for example, in the city tools to say you can't actually stay here. It is not a safe situation, and so I think it is a place of partnership for the future.
I think I'll try not to repeat myself too much, only because I know we talked about this a few weeks ago. So over the last 2 months, my team, we've started to go to these abandoned homes as a group. I don't remember if I said this last time, but we have a lot of safety issues with going into abandoned homes, whether not knowing the structure of the space, not knowing who's on the other side of those doors, and not, of course, it's just illegal for us to also break and enter into an abandoned home. But we do it just to make sure people are safe. I know there's one home that you've been aware of for several years that my team has known that somebody's been living inside, and the snow since this weekend was undisturbed as of yesterday. So we actually did get into that home to make sure people were safe inside, and it appears vacant again. With that said, over the last 2 months, I just looked earlier, we've looked at 15 homes. All but one of those spaces was around, I don't remember the council district numbers and lines, but we're all in the Zone 3 area. I think we did one in Zone 6 and one in Zone 2 as well. We're doing our best to follow up with those as quickly as possible. As Aaron said, we do notify people that they technically are not allowed to be there. There's not much that we can do at OCHS to obviously force people out. So we're just like we would do with somebody outside, making sure they're aware of mental health services, substance use services, the shelter services that are available. At the very least, people are usually at least open to talking with Allegheny Link to get onto the housing waiting lists, which, as you know, can take some time. Sometimes it's weeks, sometimes it's months, but making sure we're engaged with those people through the duration of that wait period.
Something that has helped has been working with PLI and seeing if those can be boarded up or condemned, or if it's city-owned, because a lot of the times we don't know if it's a private property or city-owned. So we meet bi-weekly with them, and we've been working on that list. We do acknowledge that a lot of them are in Zone 3 and in your district and Councilman Coghill's district. So it's something that we've been trying to figure out, because there's no guidance, law and legal guidance on how we can operate on that, except if it's private property. So I think that it would be helpful to maybe have a policy around that, a city policy or something that could help us out. What we can do is check on the individuals, make sure they're safe, and try to get them to engage with us. And then we had one in Zone 6 that was reported by Councilwoman Kell Smith, and we had our team meet with the PLI inspector. And so that was helpful in that case, because then if someone is there and they experience like a crisis or are not willing to respond to the inspectors, they will talk to either our case managers or social workers. So we're trying to creatively think of ways that we can support you all without having much legal guidance, except if it's private property.
And then I guess the last question I have is just hearing a lot that a lot of this year's plan is similar to last year's plan. I'm curious, like, what kind of anyone here believes are the next steps? What we would like to see in 2026's winter plan, as we're looking forward to that, and we're learning what is working and what's not working this year.
The first thing that comes to mind, so I know, like, last year, I think what we talked a lot about was some capacity issues, and those have historically always been troubling. At least this winter, we don't have capacity issues. But what I hear from my team and what I've experienced personally is like safe discharge planning. We really try hard to work with the hospitals. We try hard to work with Western Psych. And maybe the worst offender of them is like some of the substance use treatment centers, where people are willing to go inside, and then we do everything we can to set up a safe discharge, and then they're discharged without us knowing. This is something we've also struggled with as long as I've done this work, and it doesn't really feel like it's gotten much better. So I personally think that's one of the next best steps when somebody is taking this like huge leap to get into a treatment center and then is just kind of put right back on the street after. It's really difficult to encourage them to get treatment elsewhere, even if it's just utilizing the shelter system.
Can I just ask, and who's allowing that to happen?
So this isn't one person or organization specifically. We deal with it a lot with, which has gotten a little bit better, but with Allegheny County Jail, we've dealt with it with all of the hospitals. They have, I think, we've heard this from police too, where it's like there's never just one contact person. They get to know somebody, and then the person turns over to a new position, and then they just don't get a new contact number. We've really tried hard to keep those updated, whether it's just Allegheny Link's number or Roots number. But yeah, when I talk about like substance use
I'm
programs,
just trying to figure out how we can help, that's all.
yeah, a lot of these substance treatment programs are actually out of Allegheny County that we utilize as well. Oftentimes we hear people who want to get treatment, they want to be far away from their network of people.
As they say, you can't get well where you got sick, right? So,
Yeah,
Ricky
and so
Lee told me.
those I think have historically been like the most difficult to coordinate with, where it's like we don't get regular updates for good reason. They're also very strict about what information they share with outreach, and so it's really difficult to form this connection where we can make sure somebody is welcomed back into this this county without just ending up on the street.
I was just going to add one thing about I think for many years the winter shelter is, it's a life-saving measure for the most part, right? And you add a bunch of shelter beds for a period of time. I think what we're doing a bit better is trying to sort of triage what folks what their needs are in terms of other housing opportunities. We opened up just a small program this late summer and fall that was just like a 25 bed. We call it like a triage shelter, which just means that we were sort of really directly taking referrals from street outreach teams across the county to get people into that program and then help them sort of navigate the shelter system and other housing resources, maybe connect them back to their housing program if they're in one. And so that work is continuing through the winter shelter, and then we hope that would continue in the springtime as well. So I just think, you asked about next steps. I think continuing that type of work going forward will just help. One thing we saw last spring is that a lot of people who were using winter shelter as it was phasing out had been there for many weeks and months in the winter, and that's not the case so far. People are not staying a long time, but if you make a shelter that's comfortable and pleasant, people tend to want to be there. They get comfortable, and that's a good thing. But also, it's a limited resource. It will end. So the more work that we can do to help people navigate the housing system, we're doing a lot of that now and just continuing that.
I would say for next year, I think something that has helped but needs to be increased is transportation. That's the biggest barrier, particularly in the East End. So maybe adding a stop or a shuttle in the Homewood area that's experiencing a lot of homelessness, particularly supporting ECM. I know our Roots team has, in Zone 5, our team lead has expressed that it'd be really helpful to work through that barrier of transportation in Black and brown communities that don't have the same access, and make sure that we, if possible, we get another shuttle or a shuttle stop, because that has been amazing this year, having those extra stops.
Maybe there's something we can do more now to enable ECM to get people to winter shelter, sort of driving the shuttle all the way out to Zone 5. But yeah, so that's something maybe we could even do for this year. I thought these were all good suggestions. I agree with Ben. It is a real struggle, particularly with the hospital systems, who will let anyone go from there, and without necessarily the right discharge plan.
I've heard some real horror stories with that, like people still having IVs in, and there's kind of,
Yeah,
yeah.
and while we work with them in those situations, and we have plenty of partners there, systemically, I also agree with Ben that it hasn't gotten much better. So it's something we have to keep working on for a systemic solution. There's progress, and then it falls back sometimes. Ideally, I would say if we're looking at next steps in a really hopeful way, if we can continue to bring on additional housing so that people stay in shelter for less and less time, we will need fewer and fewer shelter beds, and then we can reinvest that money into more housing, and then we will need fewer and fewer shelter beds, and then people will get what they want initially, which is housing. And so that's why the balance between making sure people can be safe and have the shelter accommodations that they need, particularly on the most difficult weather nights, has to be balanced with investments in housing. And so I mentioned we are issuing a solicitation very soon for additional housing resources. We already talked about 500 and 500 as another pathway out. If we can make these shelter stays really brief and non-recurrent, then we'll need fewer. Like, I would love to be reporting fewer shelter beds with capacity in the system, with people getting to what they really need.
Anything else? No one else joined us?
Talk about this stuff all day.
What's all right. So thank you all for being here, and we will land this plane. So having exhausted the business of this post agenda, this meeting is adjourned.